you having surgery on a broken bone or damaged joint? These kind of operations are usually done by an orthopedic surgeon. This video is for patients considering their anesthesia options for orthopedic surgery. One important option for many such surgeries is regional anesthesia, also called a nerve block. You should discuss with your anesthesia provider whether or not regional anesthesia will benefit you. When used with a sonogram, also called ultrasound, regional anesthesia is proven to reduce pain and nausea after your surgery and let you go home sooner. It is also proven to reduce pain and the need for pain medicine in the hours and days after your regional anesthesia wears off. You can still go to sleep and wake up after surgery if you consent to regional anesthesia. Why both? Why not just knock you out? After surgery with a nerve block, you can expect to awake with numbness in the area of your surgery. This temporary loss of sensation in the region of your operation means less opiate pain medication during and after surgery. That means less side effects, less nausea, less sedation after, and less exposure to potentially addictive medication. Nerve blocks are typically done before the surgery with you partly or deeply sedated, as your provider may occasionally need verbal response or cooperation before positioning you in your operating room. Usually, your anesthesia provider will use a sonogram machine, called an ultrasound, to help guide this injection into place. It's also possible that a nerve stimulator will be used. This gives small pulses of electricity into your arm or leg to help confirm the correct place for injection. This will cause muscles in the area to contract once or twice a second, but is not painful. You should be aware that there is no proof that a nerve block reduces the very small but always real risk of serious outcomes or death from surgery and anesthesia. For that reason, it is rarely necessary. However, it is often a terrific addition to, or even replacement for, sleeping anesthesia. If you are having surgery on your shoulder, elbow, wrist, or hand, your provider will likely offer a nerve block on or near your brachial plexus. This is a collection of nerves that go to your shoulder and all the way down to your fingers. After such a nerve block, most or all of your arm will be numb for about a day after surgery. It will be difficult to move your hand or fingers. Your arm will be so numb, it is also possible that you could burn yourself and not feel it. For that reason, keep your operative hand and arm away from cigarettes, the stove, or anything hot or sharp. Although much less common, it may happen that your eye on the same side as a brachial plexus block appears bloodshot, droopy, or occasionally tears. This is uncommon but mildly unpleasant. The good news is that it is temporary and will resolve within a day or two as your nerve block wears off. For surgery on your hips, knees, or below, different nerve blocks are available. These techniques might include a single injection in your back to numb you from the waist down, or they could focus only on the operative leg or foot. Each kind of injection has varying benefits and a few small risks. If these descriptions give you pause about accepting regional anesthesia, or even about having surgery altogether, that's okay. Now you have some idea of what to expect and what to ask. We encourage you to have this discussion about regional anesthesia with your provider on or before the day of your orthopedic surgery.
This video is brought to you by Anescribe.